Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Subscribe the channel if you have not. And we are just discussing just like that, honestly. Again, it's always a guesswork that what kind of a letter can come. But yes, there is a word that is respite care. Respite, respite care. This is a letter that does not come often, but yeah, it can come. Respite care means that suppose if a patient is in long-term care, when will the patient will be in long-term care? It's only when the patient has terminal illness. Terminal illness means cancer, end stage kidney disease. So when the patient has terminal illness, that means the illness that cannot be cured, then the patient is in the palliative care. Palliative care means that patient cannot be cured. He can only be treated for the symptoms. This is known as palliative care. And there's another word, hospice. So palliative care is normally given at a place, not in the hospital. Hospice is the place where you get palliative care. So again, I will repeat the words: terminal illness, end stage disease, palliative care is equal to palliative care treated in hospice, HOSPIC. So these are the common words. So respite care means now the patient cannot be treated, but he is taking long term care. So you are the nurse of the patient, and maybe you are going on a holiday, or maybe you are going for some important task, or maybe patient has got some other illness due to which now other nurse will provide temporary care. That is known as respite care. Respite is equal to kind of a word for recess. Like in the school, colleges, we used to have recess. So that is exactly the word respite care. So this can come because it's a very different letter. Second kind of letter that is important in today's OET time, because they are making letters a little tricky. But yeah, otherwise OET writing is very easy to be cracked. The second is, suppose if the patient was treated in the hospital, then patient was shifted to our community health center, and now he is better. Oh, patient was shifted to our rehabilitation hospital. So big hospital, middle one, rehabilitation hospital. Now the patient is going to community health center for the follow-up care. Means patient had some serious illness. Patient was treated in the hospital. Then he wanted only rehabilitative services. He was sent to us. And now we have also treated the patient. He is going back home. After going home, he will be visiting community health center for the follow-up or checkups. So these kind of letter, we will say, I am writing this letter regarding Mr. X, who was admitted in that hospital on this date for this and this thing. After treatment, passive voices, was plus third form. He was admitted in that hospital. After treatment, he got better and he was shifted to our hospital for rehabilitative services. Now, after our services, his condition has become much better. So he is being discharged, but he still requires follow-up care. Hence, is being referred to your community center, or hence is being sent to your community center. So that means that now, and you need to provide the follow-up care again. Was admitted on this date for this. After treatment, he got better. So was shifted to our was plus third form. After taking a full stop, after taking our services, he is even better. And but now positive thing better, but negative thing, but he requires. But is used when positive and negative combines. So after taking our services, he became better, even better, but he still requires follow-up care. So after discharge, you are advised to provide him the follow-up care. So after discharge, you are advised to provide him the follow-up care. That's it. These kind of the letters are coming, and this is the maximum difficulty of letter. No matter how difficult the letter is, always start the letter from end. First of all, try to find to whom you are writing the letter. First thing is, हम letter किसको लिख रहे हैं, to whom we are writing the letter. Second thing is, what is the purpose of the letter. If these two things are correct, and your grammar is correct, nobody can fail you in OET writing. Make it, no matter how difficult the letter is, make it a very simple letter. Even the letter that I have told you, you can make it simple. I'm writing this letter to refer Mr. John for the follow-up services. That's it. Even then you will pass, because ultimately the purpose of the letter is follow-up services. So even then in the first paragraph you will pass. But the best way is that he was admitted on that day. After taking treatment from there, he was shifted to over, because this completes the story, and then you get more than 350 if you want to get more than 350. So listen to this video 3 times again. One time does not work. Not for night, neither for night writing, nor for speaking, nor for reading, nor for it. Whether you watch only 10 videos of Dr. BKM, you will have high chances to pass. But condition is 3 times one video. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you very much. Everybody got it? Everybody is okay with it? This writing letter information. So respite care, and these are the words which are becoming often. Okay, ma'am. Sorted for everyone, guys. Any doubts, please? Maybe I have muted you. I will unmute you. Yeah, I have muted you. Sorry. Any doubts, please? I have unmuted you.
No, sir. Thank you. Thank you for this explanation.
All
Thank you, sir.
thank you very much, and wish you all the best for your exam.
So